Bismillah Rahman Rahim. Welcome back, friends. Welcome to another video lecture by Kame Biology. Okay, so we talked about the introduction and we talked about the sign and symptoms, and also we talked about the gluten. Okay, so now this is another video lecture of the celiac disease, and in this video lecture we are going to talk about causes of the celiac diseases. Okay, so there are many main causes, or there are many main causes due to which the celiac disease will be occur. Okay, so the first causes of the celiac disease is the glutens. It is caused by a reaction to gluten, means gliadins and glutenins. Okay, so I already talked about the glutens. If you missed the video about the gluten, so go back to my channel. There will be a gluten there will be a separate videos lecture on a gluten. Okay, now what is gliadin? Gliadins are the small peptides, or we can say the small peptides of the proteins. And what is glutenin? Glutenin is actually, it is means protein fibers. Okay, so it is caused by what? It is caused by a reaction of glutenin. Now second sentence says that it is means that first of all, means the first, you know, celiac disease is the first time the celiac disease may be activated after surgery. Okay, so the celiac disease for the first time the celiac disease may be activated after surgery, pregnancy, childbirth, viral infection, or severe emotional stress. So due to these kinds of condition, the celiac disease will be activated for the first time in the body. Okay, so there are some other main causes due to which the celiac disease will be occur. So it will be the type 1 diabetes. During this disease, the pancreas will lose their function. As all of you better know, the pancreas will release insulin, which are responsible to break down the sugar molecules. Okay, so when the sugar molecule are not break down, so it will cause what? Type 1 diabetes. Then we have another condition due to which the celiac disease will be occur or caused. It is thyroid condition, means thyroid problems. This is another main causes of the celiac disease. We call it ulcerative colitis. Okay, ulcerative colitis. Now neurological disorder is another main causes of the celiac diseases. Okay, Down syndrome and Turner syndrome is also the main causes of the celiac diseases. Now in this slide I must tell you, or I will show some pictures of the diseases due to which the celiac may be caused. Okay, so this is the Down syndrome. So Down syndrome is also the main causes of the celiac disease. Now this is the thyroid problems. So in thyroid problems, what actually happen, the thyroid glands will be swell up, due to which the neck portion is also swell. So this is the thyroid problems. Okay, and it is also called the celiac disease. Neurological is also the main symptoms, or it is the main causes of the celiac disease as well. Now then we have ulcerative colitis. Now all these are what? These are the types of ulcerative colitis. Okay, if any one of them colitis occur, so this, due to this ulcerative colitis, the celiac disease will also occur. Okay, then this is the Turner syndrome. Okay, so Turner syndrome is also the main cause of the celiac diseases. Then we comes about the epidemiology of the celiac disease, that how many people will be affected with the celiac disease. So as I already tell you, that celiac disease will affect the genetic person, and they will also affect the children at the age of 6 months to 2 year or 4 year. Okay, so let me tell you some other important things about the epidemiology. Globally, celiac disease affect between 1 in 100 and 1 in 70 people. Okay, so that's the rate in which celiac disease may be happen in the people. Okay, now due to visible or we can say due to variable sign and symptoms, you know, it is believed that about 85% of the people will be affected of the celiac disease. Why? Because such people, you know, such people are not diagnosed. So when the people are not diagnosed, so then celiac disease will affect 85%. Only 1 to 2% people will be diagnosed, due to which 1 to 2% people don't have the celiac diseases. So after that, then we will talk. The risk factor of the celiac disease. That what kind of risk factor will be occur when a patient have a celiac disease. Then which kind of a disease will be occur? Okay, which kinds of the risk factor will they have? So when the people eat the gluten, so there will be increased risk of the celiac diseases. Okay, so celiac disease is not only occur in the baby life, it may be occur at the age of the adult as well, and it may be increased at the age of 6 months and at the age of 4 years. Okay, celiac disease is also increase the chances. Celiac disease also increase the risk of the both adenocarcinoma, means adenocarcinoma, and lymphoma of the small bowel, means small intestine. Long-standing and untreated disease may lead to other complications such as ulcerative gingivitis and stricturing. Okay. Now, what actually happen in ulcerative gingivitis? In ulcerative gingivitis, there will be ulcer formation on the small bowels. Okay, so there will be ulcer formation on the small bowel. And what actually happen in stricturing? In stricturing, what actually happen? In this case, there will be, the bowel will be obstructed. How the bowel will be obstructed? The bowel will be obstructed due to scarring, or we can say it will be narrow, or it will be obstructed due to the structuring. Let me show you some diagrams about that. I will show you the diagram in the next slide. Then there will be another complication, or there will be another risk factor of the celiac disease, and that's about the pregnancy complication. Means what actually happen in this pregnancy complication? There will be pregnancy complication include miscarriage, intrauterine growth restriction, okay, and low birth, and we can also say that there will be also preterm birth as well. So all these are the pregnancy complications. Then we have another risk factor, that's we call that hyposplenism. Okay, what is hyposplenism? In hyposplenism, the spleen will be affected, means the spleen size will be affected. Then we have another risk factor, that's we call that dermatitis herpetiformis. Dermatitis herpetiformis. So dermatitis herpetiformis is another risk factor of the celiac diseases. During this stage, as I already talked about, during this condition, what actually happen? There will be a rashes or blister, which is extremely itchy, appear on the arm and on the abdominal area. Hypothyroidism. Hypothyroidism is another risk factor. Then we have primary biliary cholangitis, microscopic colitis, gluten ataxia, cirrhosis, vitiligo, autoimmunohepatitis, and primary sclerosing cholangitis. All these are the risk factor of what? All these are the risk factor of the celiac diseases. So now in this slide I will show you some pictures of the risk factor. So this is the vitiligo. Okay, there will be a chances of the vitiligo disease due to the celiac diseases. Now this is hyperthyroidism, as you can see. Now this is the intestine. Now this, as you are watching, this is the normal intestine, and this is the structuring intestine. Okay, due to this way, the means the walls of the intestine become narrow, and it become narrow. Now this is the cirrhosis. Then this is the diagram of the lymphoma. Okay, so all these are what? All these are the risk factor, or all these picture are the risk factor. The next headings is reduction of risk factor. Means how we can reduce the risk factor. There will be two main things that we can reduce the risk factors. The first things is breastfeeding. Okay, so prolonged breastfeeding, you know, it will reduce the risk factor of the celiac diseases. So prolonged breastfeeding until the introduction of the gluten containing grains into the diet appears to be associated with the 50% reduced risk of development celiac diseases in infancy, means in the children. Okay, so whenever we provide the breastfeeding for a longer period of time, so maybe it will reduce the risk factor. Okay, so all that's about the celiac disease, means the epidemiology and the causes and the risk factor of the celiac diseases. Inshallah, in the next video lecture we are going to talk about the mechanism of the celiac diseases, means how celiac disease is happening in our body, or what actually happen inside our body during celiac diseases. Okay, that how a celiac disease are, you know, activated inside our body. So we'll be talking in the next video lecture, so please stay tuned and continue to watch the video. Thank you.